Hi, I'm Moheb Gaid. I'm a consultant rehabilitation medicine in Norwich, and I have here Dr. Imad Sedki, consultant rehabilitation medicine in Stanmore. I would like to ask you, Imad, first to talk to us about what do you do in your day-to-day job and your current practice.
Well, I have dedicated my whole career to amputee rehab. So actually, I do all my work with amputees for the past 15 years. I've been doing that. My job is based as outpatient work, where I don't have inpatients or ward cases, which enables me also to have a bit of life-work balance in a nice way. I work in Stanmore and also in Luton Centre. Both centres have similarities and differences between them.
Can you tell us how did you specialize in rehabilitation medicine and your background before that?
So it's an interesting story actually, because I started off as an orthopedic surgeon and I was determined to spend my life in theatre, operating, and I actually did some amputations myself. But then I found it a little bit hard just to see my patients asleep and not have a chance to talk to them much, not to get to know them. And of course, the on-calls and the life-work balance with the orthopedics is quite hard, and it gets harder over time. And one day I was taking a referral card to a colleague of mine in St. Richard's Hospital in Chichester, and I was asking her to rehab one of my patients. She started talking to me about the specialty, and 2 months later I was on the rotation in London and never looked back again. So I think the path led me through my interest in limbs in general in orthopedics, but also prosthetics in particular has a niche in rehabilitation medicine and the practice, and the way it's practiced as an outpatient-based specialty with some inpatient rehab, which attracted me to it.
So I take it you did the CCT program rather than the Caesar route.
Yes, I went through a CCT program, 4 years training in London rotation, and that was actually quite nicely balanced because it allowed us to have some also optional attachments where I was able to increase the time I did in prosthetics. To my good luck, my training consultant, Dr. Linda Marks at the time, was planning to retire exactly the same year when I was, by chance, going to finish the training. So I was looking at her job from the start.
Right, and finally, can you tell us of what was the perks of being a rehabilitation physician?
Oh, where do I start? Where do I start? So you're getting the best of both worlds. You're able to make a huge difference to your patients, get to know them lifelong, and get the job satisfaction by actually making a big change to their lifestyle. Yet you are not as stressed and anxious, although there are stressful days and there are difficult days sometimes, but these days, in terms of percentages, are a little bit less than orthopedic surgery. And also, I'm not wasting a lot of time preparing for theatre cases and then, the aftercare and so on, which are the tedious things that we had to do in orthopedics. Now I just go straight to the point, look after the patient, and then move on to the next one. I've got also a big team in the centres I work in, so it's a very, let's say, sociable kind of career and more, let's say, extroverted. I'm initially introverted, but that took me out of my shell when I'm at work. Quite enjoyable.
Thank you very much.
All right.
Thank you.
Thank you.